Good afternoon, sir. First of all, we'd like to thank you for taking out time to have this discussion with us. And also we want to appreciate the work that you are doing for the state and for the people of Nigeria. So our first question is this. Someone says, I would like to first and foremost, importantly, commend the efforts of our courageous medical teams at the forefront of the battle against COVID-19. We have seen a regular pattern with some affected nations of the world that the COVID-19 crisis reaches a peak with numbers of infected people and the numbers start dropping. When does it seem that we will reach that peak in Nigeria, especially Lagos, and the curve will begin to flatten?
Yes. So each country has a different dynamic. It's related to the environment. It's related to the ethnicity. It's related to the demographic profile. We know that the COVID virus has a predilection for the older age group, for people with other comorbidities like diabetes and hypertension and other diseases that affect the integrity of the immune system. We don't really understand the relationship between the virus and different diverse ethnic groups. So only time will tell how the virus will relate with people of the African stock. We also don't know how the virus will relate with other infections in our environment, like malaria and typhoid and other coronaviruses. So it's almost impossible at this point in time to define the profile of the outbreak in Africa or in Lagos or Nigeria, to be specific. We have certainly put a lot of interventions in place, and we believe that those interventions are working, and that's why the slope of the curve is very gentle, as opposed to what we saw in Europe and America, where they had a very steep gradient. So we're very grateful that we have a gentle gradient, because that means that it gives us time to put our act in place, to strategize, to put infrastructure, to train, to develop, and to learn some of the medical experiences that are happening in other parts where they've had a massive outbreak, to learn from the research going on. So the longer we can flatten our curve, the longer we can prolong the outbreak in Lagos, the better it is for us in terms of being able to manage the cases and have a preferential outcome and fewer casualties and fatalities.
Thank you. All right, the second question is the state considering floating an online platform for medical consultation in order to ensure the required physical social distancing?
Yes, we've already launched that. It should come on stream next week. It's telemedicine, and we will use that platform to both consult remotely, but also use it for education and training, so that we can recruit people from other environments to give assistance to some of the doctors on ground from the experiences in other areas, but also we particularly want to use it for patients to have remote virtual consultations, thereby removing the need for them to leave their homes if they need or want medical attention.
Thank you, sir. Let me ask this question. Over the last 4 or 5 days, we've been having higher numbers. There seem to be a spike in what is the virus in Lagos. What could be responsible for this? Is it the testing that is increasing?
Well, it's not a spike. If you look at the graph, it's just a gentle slope. We expect to see more cases every day until we reach our peak. So a spike would be going from 10 a day to 50 to 100 to 200. That would be a very steep gradient. What we're seeing is a very gentle gradient. We're going from 10 in 1 week to 15 the next week to 20 the following week. And if you look at the graph that we have displayed on the media, you can see very clearly that the slope is very, very gentle. And that is a manifestation of what we call flattening the curve. So we know we haven't reached our peak. And we know we're going to start seeing a few more cases every day. But it's the rate of change that's important. If we went from 10 a day to 100 a day to 200 a day, then we know that we've had very little impact on flattening the curve and making sure that we don't see too many cases in a very short period of time. We are just actually buying time because this virus is trying to infect as many people as possible. And what we're doing is we're interrupting that opportunity, thereby giving the states the leverage to pull in different resources and different strategies.
All right. There's a question they sent in this, and the question is, what is the state government doing about private hospitals that seem to be treating COVID-19 cases without proper authorization?
Okay, well, my colleague is here, who is the chairman of the Health Management Accreditation Board. So I'll pass that question right over to her. She's more equipped to answer that from the board's perspective.
All right.
And her name is Dr. Yemisi Sholanke Koya, the chairman of the Lagos State Health Facilities Management and Accreditation Agency.
Good afternoon. Thank you very much for that question. And how we're handling it is through a structured mechanism whereby the facilities in Lagos State are engaged with the state through a public-private collaboration. So when we hear from the facilities and they indicate their preference to treat COVID-19 patients, for the protection of all Lagosians, we must ensure that they have the capacity to do so. So the team from HAFAMA will go there, inspect, and we will detail the inspection findings. If the findings suggest that they are not ready or they have a few deficiencies, we will communicate the deficiencies to them and we'll ask them to cure those deficiencies. When the deficiencies are cured, then we will issue them a letter telling them that they are approved to participate in the statewide response to COVID. However, that will be under strict guidelines through the state and also continuous monitoring so that we can ensure that the Ministry of Health's directives are complied with all those facilities.
Thank you very much.
Thank
All right, I think we have clarity on that now. Thank you. Sir, there's this question I want to ask. With the federal government doing a shutdown in 2 states and the Federal Capital Territory, now we're beginning to see more states that the virus is beginning to spread. So the question is, wouldn't it better for us to have a total lockdown in the nation than some states still going about their businesses? Because if the virus now begins to spread faster in those regions, when the curve is coming lower in Lagos, there might be a magnetic pull to Lagos to come to Lagos for treatment.
Well, that's a very hypothetical, strategic call. You know, you have to be careful that you don't lock down too early because there's only so much that people in the informal sector can tolerate without a safety net. So you don't want to create a new problem while trying to solve an issue. We're dealing with a public health crisis here, but we could easily tip the country into an economic and security crisis. So you have to find the balance between addressing the public health issue and at the same time not creating a new problem by putting people in a position where they are lacking in essential resources, food, and then we start to develop malnutrition, we start to develop a breakdown of law and order. Very few people in Nigeria, well, most people in Nigeria operate in the informal sector. which means that they depend for their livelihood from day to day. So a lockdown over an extended period of time is essentially plunging people into a state of loss of livelihood and poverty, which comes along with malnutrition and other complications. Apart from the fact that we have to be very careful that we do not plunge the economy into a state that will take several years to recover from. So these are the very difficult questions that we are grappling with, and both the public health experts and the economists need to come together. They are coming together and discussing where that sweet spot is between in trying to find that balance between managing a public health threat and ensuring that we do not create new problems in the process of that strategy.
All right, that's well understood, sir. Now, somebody asks, and the person says, how can individuals like myself volunteer to support the work Lagos State and Professor Abayomi they are doing to ensure, which means some people say they want to volunteer in this battle. Is there any way they can go about it?
Yes, we're looking for volunteers all the time. You can just call the 08000 Corona number and give your details. You can also go onto my Twitter handles, Professor Akin Abayomi, either Twitter or Instagram. It's at Prof Akin Abayomi, and you can drop a line there, and we will reach out to you and see where your skills and your expertise can be applied in this COVID response.
All right, we just have a few more questions. Is it true that infected COVID-19 people that have recovered are getting the COVID-19 virus again? Is it true that there might not be any immunity, or do you think there is some immunity that's been built, or that is still up to?
So everybody has immunity. The question is, do you have a mild relapse? So sometimes when you've recovered from an infection, the body clears it, but there's still a little bit of the virus left in the body, and maybe, you know, somehow the virus starts to present itself. But all in all, as long as you have a good immune and robust constitution, you will eventually clear the virus. It's too early to tell whether you can be reinfected by the virus, but that usually defies the law of immunity, whereby we know that once you've had infection with a particular pathogen, it kind of protects you from being reinfected again in the future. It's not a golden rule, but it is just generally the way the immune system works.
All right, sir. Now, the next question is rather long, but let me just quickly. It is obvious that a lot of resources have gone into protecting the personnel working in isolation centers and into providing adequate care for coronavirus infected symptomatic patients. At present, most hospitals have reduced their elective medical services, but urgent care and emergency services are being provided, including surgeries and maternity care. With the community spread of this infection, patients who are not infected with the virus and patients infected with coronavirus who may be asymptomatic or have symptoms or are bellied by other medical conditions are presenting to hospitals, not isolation centers. So the question is, what preparation and policies are in place to protect health workers who continue to see these patients in various hospitals and mitigate the risk of contracting the virus and paralysis of the entire healthcare system, and ensure that emergency services are still being provided to patients who need them without discrimination, without putting the patients who are not infected at risk?
Yes. Can you paraphrase the question? That was not a question, that was a story.
All right, so what the person simply is saying is, because there are still some basic medical services that are being offered, right, the chances are people who come for these medical services may get contaminated by asymptomatic patients who also come to the hospitals And also, what are the protective mechanisms that are put in place for medical practitioners who may be exposed to these people while just thinking that they are doing general treatment, and apparently those guys are actually COVID carriers of the virus?
You know, that's a perfect question for my colleague sitting here. So why don't you just hold that question till the end of my interview, then I'll hand you over to Dr. Sholanke, and she will take that question because there's a lot of information around and there's a lot of material in the strategy that the state is deploying for that particular issue. So finish with my questions and then I'll hand you over.
All right. Okay, the next one. We have not experienced the coronavirus on the scale that it is in other places in terms of numbers and severity of infections. Currently, we're doing a good job managing mild cases and discharging them. What is the capacity and preparedness of the critical care in Lagos in terms of ICU beds, ventilators, manpower to combat if there's any escalation? Will the state be ready to handle that?
Yeah, so we are escalating our high care, or what we call critical care capacity. We cannot mix critical care in the general hospital with critical care for COVID. So we have to build within the isolation centers, we have to establish critical care within the centers, because you can't take patients from an isolation ward to a general hospital where other patients are using the critical care facilities. Otherwise, you contaminate the whole environment. So what is causing the delay is establishing critical care within the isolation facilities. Critical care is a very complicated and expensive infrastructure. It's not something that you can set up in one day. There's lots of electronics involved. There's a special capsule that needs to be developed. We have to monitor the ventilation system. It's a very complex arrangement. So as we are ramping up our capacity, we're slowly acquiring critical care services within the isolation facilities. We haven't seen much in the way of the typical respiratory failure that we've seen in Europe, across America and China. Yeah. But we know it's coming. It's a numbers game. So at the moment, we are developing critical care in at least 4 of our isolation units. And we're training our intensivists, because critical care in Corona is new. The world is learning that high care for Corona is not high care for normal medicine. There's something quite different about this virus. And so the whole world is learning that there is a new dimension to high care when it comes to COVID-19.
All right, sir.
Can I take one last question, because I have to be somewhere else?
One last question. One last question. Let me look for one more. All right. There have been reports of clinical drugs and vaccine trials in the world. A few days ago, Lagos, in conjunction with the NCDC, started its own trials. Can you shed more light on this trial and any others being considered? Are there positive results? Any indication of it?
So we haven't started yet. Developing clinical trials is a very complex thing. We have to get it right. There's a lot of governance around clinical trials. There's a lot of ethics. There's a lot of community engagement. Clinical trials are very difficult things to carry out. We're working with several international donors. We've established a clinical trials committee. We'll be working with several academic institutions in Nigeria and outside of Nigeria. We're looking to test chloroquine and ritonavir as interventions. We're also looking to test the efficacy of what we call convalescent plasma, which is blood that we take from people who have recovered, that contains the proteins that help them fight off the virus. So when someone has recovered from COVID-19, they have those antibodies or those proteins in their blood. Then as a donation from the person who's recovered, we can use that donation to treat new cases, or particularly cases that are becoming complicated, to see if we can rescue them from severe complications of COVID-19. We're also trying to validate these rapid test kits that everybody's talking about on social media. It's
Yeah.
important that we validate them in a way that we are confident in the results that we get from them. Rapid test kits can be notoriously very inaccurate, and the consequences of running inaccurate tests are very severe. So we're not just going to accept any rapid test kit on the market. We're going to make sure that we have confidence in its specificity and its accuracy, so that we are not putting our population at risk in the interest of saving time to do the testing. So there are multiple things that we're going to be doing in the next couple of weeks as this outbreak expands. We will be doing the clinical trials, we will be doing validations, and we will be carrying out all levels of research, both scientific and anthropological, and in terms of infection prevention and control. So I'd like to bid you goodbye. I have
Thank you very much for your time. I really appreciate it.
Yeah, so I'll hand over to my colleague, Dr. Yemisi Sholankoya, who will address the issues around the accreditation of facilities and the infection prevention control measures that we're putting in place to ensure that our staff, our frontline workers, are as protected as possible. Thank you very much. Pleasure being with you. Bye-bye.
Thank you, sir. All right, sir. All right, ma'am. I know you're very busy. I'll just give you one question.
Thank you very much for that.
All right, then. All right. So the question that I asked, I'll read it out again, okay? And it says, it is obvious that a lot of resources have gone into protecting the personnel working in isolation centers and into providing adequate care for coronavirus infected symptomatic patients. But at present, most hospitals have reduced their elective medical services, but urgent care and emergency services are being provided, including surgeries and maternity care. Now, with the community spread of this infection, patients who are not infected with the virus and patients infected with the virus who may be asymptomatic or have symptoms bellied by other medical conditions are presenting to the hospitals and not the isolation centers. So the problem or the question is, what preparation and policies are in place to protect health workers who continue to see these patients in various hospitals and mitigate the risk of contracting the virus and paralysis of the healthcare system? And the second is to ensure that emergency services are provided to patients who need them without, putting the patient at risk of getting infected by the virus. So what the person is saying is, people are coming in who are asymptomatic, and that may put the doctors at risk and other patients who came just for other things at risk. So how will what are being policies and plans are put in place to mitigate against doctors getting infected and the regular patients getting infected by people coming in?
Thank you very much for that series of questions. So the first thing is, the first thing to talk about is the training that is being conducted for hospital staff. Staff is being trained, if they've not already been trained, in infection prevention control measures to ensure that universal precaution mechanisms are used all the time to protect staff that may be getting in contact with patients. As you indicated, patients may be asymptomatic. So we're trying through the state government to encourage a high index of suspicion for any individual that's coming into a hospital. We have provided protocol to hospitals to have a triage center very close to the entrance of the hospital, so that when patients come into the hospital, they are screened there and triaged appropriately by asking them a series of questions, taking their temperature and estimating their risk, trying to identify their risk. And if the individuals determined to be someone who may be a high index of risk, then appropriate protocol will be used at that time, so we can minimize the spread of the infection within hospitals. Also, we're trying to ensure the welfare of the staff, and we've actually informed the hospitals to ensure that they do establish teams that will be in charge of their own staff, so that those teams can regularly ask and monitor their own staff members. If they suspect that the staff member may be coming down with one of the constellation of symptoms, that then the isolation protocol starts. And if by any chance it is determined through the course of investigations that the patient is positive, we are asking that the hospitals isolate their staff for a period of 14 days. They'll have to temporarily cease admitting patients through inpatient or outpatient so that we can protect all the healthcare workers, mitigate this spread by also line contacting, find out who their contacts are, and also establish the protocol for protection for the contacts as well.
All right, ma'am. Thank you very much, ma'am. Thank you so much.
Thank you. And I bid you safety during this period as well.
Thank you, sir. Same to you, ma'am.
All right. Thank you very much. All right. Bye-bye.